I'm Jialu Streeter. I'm a research scholar at the Stanford Longevity. My guest today, Gopi Shah Goda, is a senior fellow and deputy director at the Stanford Institute for Economic Policy Research. Gopi is an expert on the economics of aging, retirement, and insurance. Gopi Shah Goda, welcome.
Thank you, Jialu. It's a pleasure to be here.
A lot of your research focuses on retirement, right? Retirement and aging and longevity. So many people, especially younger ones, may think, wow, retirement and aging are far in the future, right? Can you tell us just like why this field is important and everyone, regardless of age, should pay attention to it?
Absolutely. So I've been a student of public finance since the middle of my years as a graduate student in economics. And as I began to learn more about where the expenditures in the US federal budget go, I began to appreciate the fact that a lot of expenditures go towards programs that are for the aging population. So I actually teach a course to undergraduates called the Economics and Demographics of Aging in the United States. And the first week, what I have to do is really convince these undergraduate students in their early 20s that something called economics of aging is actually important, and it actually affects their lives just as much or maybe even more than the currently aged population. So the reason behind that is because a lot of expenditures for the aging population are actually being paid, are being supported, financed by taxes that current workers pay into a system like Social Security. So as someone age 21 or 22, someone who's just entering the job market, the ways that Social Security are reformed potentially in the future might have a bigger impact on those starting out their careers relative to people who are at the later stages of their careers.
For people who are already retired, there's really, they can't really save more unless they go back to work, right? So like, do we have any sense as economists, like roughly what percentage of the current retirees should be okay for the rest of their lives?
One thing that makes it challenging to answer that question is that people have different preferences as to what kind of lifestyle they prefer to have in retirement. So someone who may want to take several vacations every year may require more of their income being replaced relative to someone who does not foresee themselves taking a lot of vacations, for example. There's also a lot of uncertainty in terms of medical expenditures. So in particular, despite the fact that many elderly individuals are covered by Medicare for their health care costs, there's still significant out-of-pocket expenditures that some people face.
For the working population, there is still time, right? So do you think, people today in their 30s and 40s, do you think they're on track for a comfortable retirement, or maybe they're not saving enough?
Well, oftentimes decisions made about savings early in one's career can have a big influence on how much retirement savings you have during retirement. And that's basically because of compound interest. So if you start saving young, then you can accumulate more as time goes on. And that's related to a phenomenon that my co-authors and I have studied about exponential growth bias. So what we found is that people tend to underestimate the amount of exponential growth. And because they underestimate exponential growth, it seems that they also accumulate less in retirement savings. So this could be because people save less because they don't appreciate how much those savings will accumulate to by the time they get to retirement.
I see. I remember in your paper, there's also something called present bias, right?
Yeah, so the concept of present bias is basically how economists refer to procrastination. So the idea is that you make different choices today about the future than you would if you were standing in the future and offered that same choice. So the example that I often like to give is an example of someone deciding when to do their taxes. So suppose you ask someone, would you like to spend 7 hours doing your taxes on April 1st or 8 hours doing your taxes on April 15th? Suppose you ask that question on February 1st. Maybe a lot of people would take the option to do their taxes on April 1st and spend 7 hours instead of 8 hours on April 15th. But it's possible that those same people, when asked on April 1st, will then make a different choice. So they'll actually choose to spend 8 hours on April 15th rather than spending 7 hours today. And that's kind of a simple illustration of present bias, which essentially can lead to procrastination. We try to measure this in a sample of individuals, and we find that a significant share of the population displays some evidence of present bias, and those who have this characteristic also appear to accumulate less wealth in retirement.
If I know I'm a type of procrastinator, what can I do to help myself?
Yeah, so you can set up different ways to commit yourselves to save more in the future. There are actually programs available that some employers adopt, which involve committing future wage increases to retirement savings. So this is known as Save More Tomorrow, and it would allow someone to pre-commit a future increase in earnings to their retirement, which would then be kind of the path of least resistance rather than requiring action in the future to increase retirement.
For some of us who may not be familiar with it, can you just tell us what is long-term care?
Yeah, so long-term care is a phrase that's used to denote various services that people receive when they have limitations in their what's known as activities of daily living. So these activities of daily living are things that all of us need to do in order to sort of live our lives at a very basic level. So things like feeding yourself, using the restroom, transferring in and out of bed, walking across a room, for example. And there comes a stage where people need assistance with one or more of these activities of daily living, and they have a condition that doesn't have a prognosis of that need going away in the near future.
I feel I hear about the term long-term care a lot more just in the past several years. Why is it important to American families?
Long-term care is a big expenditure risk that people face, and as people grow older and life expectancies increase, it's also possible that we have a bigger need for long-term care services as time goes on.
What kind of programs out there will help normal American middle-class families pay for long-term care?
Yeah, so there's, if we think about formal long-term care services and how they are paid, a relatively small share is paid for by Medicare, and that's because Medicare really only covers short-term care and not long-term care. Medicare is a universal program for the over 65 population, but it doesn't really cover long-term care expenditures. On the other hand, Medicaid, which is a means-tested program that is jointly administered by the federal government and all 50 states, does provide coverage for long-term care that varies to some extent across these different states. However, because Medicaid is means-tested, it means that you have to spend down your income and wealth substantially in order to qualify for long-term care services through Medicaid.
So if you're not qualified for Medicaid, suppose you're a middle-class American family, then most likely you will have to rely on your own savings to pay for long-term care.
That's right. Most people in that category would rely on their own savings. There is a private insurance market that covers some of these expenditures, but private insurance is not very prevalent among the over 65 population.
Why is that?
So the market for long-term care insurance has changed pretty dramatically over the past 15 or 20 years. So many insurance companies have actually stopped offering new policies for long-term care insurance, and others have increased their premiums to a point where many people find these policies unaffordable.
Your work on long-term care is closely related to aging societies. So on one hand, people are living longer, but at the same time, in many countries, especially rich countries, the fertility rate is dropping. So for example, in South Korea, their fertility rate was only 0.92 in 2019. That means less than one child per woman. And also the number of their newborns last year fell below the number of deaths.
Wow.
Yes. So what do you think are some of the factors that may have contributed to an aging population?
So in the U.S., we've been relatively lucky. The fertility rate in the U.S. is still about 1.72, but it has fallen over the past 10 years. And a lot of oftentimes the fertility rate it goes lower during recessions. But after the Great Recession in 2007, 2008, the fertility rates never really recovered. The other contributing factor to aging societies is mortality reductions. And as mortality falls and people are living longer, and if that's combined with lower fertility, then you have a higher share of the population who is, say, above a certain age. And that can put more strain on different economies because so much of expenditures are related to supporting the aging population.
In China, now they have adopted the three-child policy, right? And I was born in a time when there was one-child policy. Every family can only have one. I'm just curious, why things have changed so much. From in the 1980s, everybody wanted to have more, but couldn't. And now the government is saying, go have 3 children, and parents are saying no. So what have changed?
Yeah, there are a lot of factors that are probably that influence this change that's happened over time. One of those may be related to higher labor force participation among women, which has increased substantially over the past 50 years. But many women maybe feel like they have to choose between having a career or having a family.
You already said the U.S. fertility rate is not low as
Not as low.
Not as low. So do you consider the U.S. as an aging society as well?
So the U.S. is aging. It's just not as rapidly aging as many other countries, and especially the ones that you mentioned in East Asia, but also in Western Europe. Mm-hmm. So the United States has avoided some of the drastic changes to, say, public pension programs that a lot of Western European countries have had to implement over the past 20 years or so. But that doesn't mean that the U.S. is completely out of the woods. The U.S. still does face an imbalance in the Social Security program, where in the coming years they are expected to receive less in tax revenue than they're expected to pay in benefits. And at some point, while this can go on for some time because of extra reserves that the Social Security system built up in earlier periods, at some point this trust fund will become depleted, and that will then lead to a series of difficult decisions of how to address that imbalance. Mm-hmm. There are basically 2 ways that you can address that imbalance. One is to bring in more revenue, and one is to pay less in benefits. And neither of those are desirable outcomes, but it's very likely that some combination of a reduction in benefits and an increase in taxes will have to be instituted in order to make the Social Security program sustainable for the longer term.
What advice would you give to today's college students, when they're contemplating what they want to do in the future?
When I talk to undergraduates or high school students, I say that one of the mistakes that I made was thinking that I knew exactly what I wanted to do and that I just needed to chart my path to that goal, and then I was done. And I didn't really take into account the fact that that plan may change and you have to be sort of open to new possibilities or new experiences. Mm-hmm. And so I often give the advice that you should just, it's sort of more of a journey than a destination, and you should expose yourself to different things in order to really find the area that motivates you and that you have a passion for. If you're interested in pursuing economics, it's good to be apprised of current events and current economic debates that are going on. This has been very true over the past year, where several experts had differing opinions on just what the appropriate response should be to the pandemic, for example, and the relief that the government should provide to its citizens in light of the pandemic. And I think then there's also a question of, how to pursue an interest in economics. I think there are a lot of different ways to do that, and they don't all have to end in graduate school. Mm-hmm. So one could become an economist that contributes to these policy discussions, even if you decide that research is not a career that appeals to you.
Gopi Shah Goda, thank you so much for speaking with us.
Thank you very much. It was really fun.